Hi, my name is Dr. Ben Thompson. In this video, we will cover the One Bridge ITE hearing aid. This is a rechargeable, cheap, affordable hearing aid for under $100. And the purpose of this video is to determine, is it any good? I'm making a 5-part video series of the best hearing aids that I could find sold on Amazon.com that are under $100. Hope you're excited for this video because I'm going to share the 3 pros of these rechargeable hearing aids and the 5 cons, things that you definitely need to look out for before you consider buying them. I'm a doctor of audiology and we care about science. So in this video, in this series, we're going to use the scientific method and something that we call real ear measures. Real ear measures is a system that allows me to put this hearing aid in my ear and have a small microphone tube that records the output of the hearing aid when it's actually meeting my eardrum. From there, we can understand how well is the hearing aid working and how much audibility or speech information is it providing. Now, because I don't know you and I've never talked to you most likely, I don't know your specific hearing test. So we had to use science to help us out to make this as evidence-based as possible. There was a 2019 study that tested the hearing of 154 individuals whose hearing fell in the mild to moderate category. The ages of the individuals in this study were between 55 and 79 years old. The study took the average of all of those hearing tests and came out with an average audiogram. I took that average audiogram and I placed it into the real ear measure system so that I could measure the output of these hearing aids, these One Bridge rechargeable hearing aids in my ear as if I had the average hearing loss of 154 individuals from this study. Now on the screen, you're going to see the average hearing test result. And this is from a premium hearing aid at an audiology clinic programmed to that type of hearing test. And then you can see, boom, right away, that it's matching those targets. The single line is hitting the crosses at just the right intervals, and that means that this person would be getting the right kind of benefit amplification from the hearing aid. Let's talk about the 3 pros of these hearing aids. Pro number 1 is that they are cheap. They are under $100 for a pair of these, so that probably has your attention, and if they gave even some benefit, they might be of value to the right kind of customer, to the right kind of patient. Pro number 2 is that these hearing aids are rechargeable. They have this case which has the recharging input where you can plug right into the wall. The third and final pro of these hearing aids are that I actually found them fairly comfortable in my ear. They sat nicely, they're pretty lightweight. They didn't bother me to have the physical fit in my ear. Now it's time to talk about the 5 cons. Con number 1 is that these hearing aids did not do well on the real ear measures test. When I put it in my ear with the real ear measures system and I measured what are the different outputs for the volume ranges that I can press on the button, almost all of those were over the recommended levels, meaning that the hearing aid would be too loud. And that's not what you want. You're probably going to have a bad experience if the hearing aid's too loud. Specifically on the chart, you can see from the low frequencies to the mid frequencies at the 3 out of 4 measurements completed, the targets are lower than the output lines. That means the hearing aid is going to be too loud and there's going to be too much sound that you're hearing from these hearing aids. Remember the first image I showed you about how well that was matched? We'll put it on the screen again so you can see that's how that image was supposed to look. But with this device, at the majority of the volume settings, it was too loud for the average individual with hearing loss. Con number 2 is poor sound quality. When I had this in my ear and I was listening to speech coming from the real ear measure system, it wasn't that great. The sound quality was not great. It sounded a little distorted and not so clear. Now that's subjective, so of course, take that with what you wish. Con number 3 is that there's only one push button on the device, so there's limited functions. Typically, we want volume up and volume down and a few different program changes, but this hearing aid, you press it, and each time you press it, it goes up, 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 and if you reach the very top and then you press it again, it goes down to the bottom. So there's about 6 volume steps per ear, and that does not mean it's a bad thing, but overall limited function, and the volume change being ascending and then dropping to the bottom might cause some disturbance or annoyance for you. Con number 4 is that there is no Bluetooth connectivity. Even though these look like wireless earbuds, there is no connectivity to smartphones. Con number 5 is the occlusion effect. What that means is that whenever I put these in my ears completely, it's going to block the ears. It's going to block natural sound from coming through. If you were to put your fingers in your ears and plug your ears, it would also create the occlusion effect. Your own voice would change. Now, depending on the type of hearing loss you have, for example, the average hearing loss out of those 154 individuals that we studied, they did not need to occlude their ears. They could wear hearing aids that allowed sound to naturally come in and out. They did not have to plug their ears. Thank you for watching this video. I hope you enjoyed it. And make sure to check out the other 4 videos in this series of the best 5 hearing aids that I found on Amazon for under $100. Subscribe to my YouTube channel to stay connected, and I'll see you soon. Goodbye.